Good evening, good afternoon, everyone. Let us give thanks before we go into this meeting. Let us pray. Dear Heavenly Father, we just want to thank you for today. We thank you that you're an awesome God. We thank you, Lord, that it is you who have made us and that you're concerned about every aspect of our lives. Lord, we want to especially thank you for all the participants who are here today and all those who would speak and try to divulge knowledge to us today. We ask, Father, that you give them clarity of speech. You would help them to divulge exactly what it is that they would have us know about management of these injuries. Father, we just want to thank you that from generation to generation, you are God, and that you are in control of everything we do, every aspect of our lives. Father, we ask that you bless us together again as we continue to help to take care of our athletes in Jamaica and around the world. We thank you for this medium, awesome medium, so we can reach so many other people through this medium. In Jesus' name we pray. Amen.
Amen.
All right, so as I said before, our first presenter is Mr. Marshall Rowley. He's a coach. He's a coach at the Petersfield High School. He has a postgraduate diploma in educational training. He has a level 1 and 2 certification in coaching. He's also certified in teaching physical education and sports. And he also has a level 1 and level 2 coach certificate from the JFF. His philosophy in life is about choices, train hard and win easy. Today, we're educating us on how he promotes such with his athletes, particularly the field event athletes, the long jumpers. At this time, I will hand over to Mr. Marshall Woolery. I'm going to ask that you please give him your undivided attention. Mr. Woolery.
Yes.
Good afternoon.
Afternoon. Good afternoon, everybody.
Afternoon, Woolery.
Yeah, I'm on the road. I was at the J3 under 20 camp as a member of the coaching staff. So tell Marlon, say, this we have to stop on the road and see what we can share my knowledge. The only problem I have right now is that I want to know how to share my information on the screen.
You have to share. You have to go down into the menu and hit share screen. You see, what are you using? Your phone?
Yes.
I'm sure it works on the phone, but there should be an area on the phone that says share screen. Okay, something's coming up. You say we're viewing your screen now. So
yeah, viewing my screen now. Okay.
Yeah, blank though, but
all right. Well, I'll still get the information up.
All right.
Still seeing my screen now?
Yeah, that's blank though. That's a blank screen.
Okay.
So we're viewing your screen, but it's blank.
I don't know why it's blank, but let me get this information up and then come back to you guys.
Okay. While we wait for Mr. Woolery's presentation to appear on screen, for all persons who are participating, just please remember while you're watching and listening to have your videos off and your mics on mute so that your background noise and so forth do not interfere with the presenter. I mean, I'll throw the participants throughout and mute people where necessary or when I see them on. But it's good if we could all police ourselves to ensure that we have a smooth presentation.
Give me a minute.
All right, we're waiting.
Where's this thing?
While we wait, I'd like to again welcome everybody on behalf of the national. You see your marker, you mark the screen with a yellow marker. So, but no text or anything up there. Yeah, welcome all people participating. Remember, the 3 semis will be awarded for this session. All paid up members are given their certificate. All paid up members on record are given their certificates free, a soft copy that they can print at their own time. If you're a non-paid up member and the required CMEs, there is a fee that can be deposited to the association's account, and the education committee will have that certificate emailed out to you at an appropriate time.
Mr. Woolray, still having difficulty?
Yeah, me try accessing my Google Drive and somehow. Let me see if
I'm
I
going to
get
give you
it.
some more time.
Go on.
I'm going to see if Mr. Doyley.
Present. Good afternoon.
Dr. Beaton.
Hello, good afternoon.
Good afternoon. I know you're pressed for time. Our first presenter is having a little bit of issues. Are you ready to present, or you need more time?
I think we should go ahead and try to go with the order. I think it may flow a bit more if we continue with that. Hopefully I can still be here throughout the entire presentation.
All right, I know you're pressed for time. That's why I was wondering.
Yeah, man, we could wait a few.
Orlando.
Yes. Yes, Woolray.
Thinking about to send you the information and you put it on your screen for me.
All right, I'm going to send you, I think it's best to send it to the host.
You're co-hosting to Marlanda, so you can't post it.
Send it to Marlando.
All right, send it to me.
You sent me an email, Marlando?
I'm going to know.
Hold on.
What's the email address, Marlando?
All right, I'm going to give it to you on WhatsApp.
Marlando@yahoo.com.
Marlando@yahoo.com.
Okay. Send it to you. I send it to you, Marlando.
Yes, okay, Woolray, give me a minute.
Now, while Marlando find the presentation, I'm looking at injuring the hamstring injuring jumpers. And it's one of the common injuries. Well, they have a few injuries that jumpers consistently play jumpers, whether the hamstring, the shin, the knee, the ankle. But I choose to look at the hamstring because a lot of explosive work. So sometimes the hamstring have more significant when it comes on to injuries in athletes overall. You hearing me, guys?
Yeah, man, we're hearing you.
Yeah, man, we're hearing you clear. We're hearing you clear.
Yes. So one thing when I look at the hamstring injury, well, you know that there are three types of the hamstring injury can occur based on sudden explosive movement caused by running or jumping. It can happen by overstretching the tendons and the ligaments. So there can hamstring injury can occur, or overstretch in general. Because enough time people stretch, but they overstretch and cause damage or tear to that muscle area. Also, you have three grades of hamstring injury. You have grade 1, a strain, grade 2, a mild tear, and grade 3, a complete severity in terms of the muscle. But we coaches know sometimes we have an issue. And we can admit on the coaches side that hamstring injury is a hamstring injury for us unless the child or the youngster go to the doctor and the doctor say, listen to me, this is a grade 1, this is a grade 2. We see it as just grade 1 or just a grade 2. Sometimes we don't really look at it from a grade 3 perspective and the severity of the hamstring injury. But we know as coaches that, hey, once athlete come to us and say he's feeling a little bit of pain in the hamstring, mean that, hey, he's developing a strain. And it can have different cause effect. It can be dehydration, it can be just damage to the muscles itself. Now, for me, while Malanda is putting up the slides, I put in some hamstring strengthening exercise to help strengthen the hamstring throughout the course of the season. I use wall slides, I use plank, I use hamstring curl using a resistance band, I use squats, and I use lunges, to name a few. Now, for these exercises, you can use weights to add resistance. You can use resistance band, different grade, because the resistance band come in at strength level, from easy to a little bit harder to a little bit harder. So you can use resistance band. I use a resistance band because you don't want hamstring to be too bulky. You want hamstring to have strength, but while having strength, you have elastic strength. And you are trying to get a 60-40 ratio between the hamstring and the quads. The quad is 60% strong, and the hamstring is 40% in strength. You don't want the hamstring to overpower the quad muscles. And that will develop more tightness. As well, most medical person here, so one muscle relax, one contract. So I use a lot of strengthening exercise, but somebody bridge also. No, I vary the strengthening exercise based on, for example, bridge. I do 3 sets of 10 reps on each leg. It slides up, I could show you some bridges that I do. For plank, I will do 3 sets of 30-second plank. And all of these exercises, you add, you increase, you can increase your reps, you can increase the sets while the season go along. It can be start at basic and move up to advanced in terms of strength exercise based on the athlete's capability during the course of the season. Well, for me, we do a lot of stretches. So now we strengthen the hamstring, now focus on stretches. Now, while strengthening the hamstring, important to get the hamstring flexible. Now, after you do strenuous exercise, the muscle gets shortened after a period of time. So you have to do stretches to keep the muscle, give the muscle a full range of motion. Not overstretch, but at least keep the muscles in the full range of motion. So important for you to demonstrate and do a lot of stretches during the course of the season also. Maintain that flexibility. Now, it may seem that way, but although I put this in the presentation itself, rehydration is also important. No, you are strengthening, you are doing flexibility work, but you have to keep the muscle fluid. So you have to include rehydration as a part of your workout routine during the course of the season. Keep that muscles fluid enough, that you have enough water, and it don't be well. The muscles contain, and the body itself contains 80% water, and the muscle mass is 80% fluid. So you want to have enough fluid night that you don't have any tightness overall. So flexibility is key. Also including rehydration. And the rehydration is not a part of the presentation, but it's key to make sure the athlete is fully rehydrated. So some of the issues I have is not per se hamstring strain, but it's from a rehydration perspective. And rehydration, apart from drinking water, you need to add some electrolytes in the water. Well, we are Jamaicans, so you can squeeze one lime in the water. One lime in the water that can give electrolytes. You drink coconut water that can give electrolytes, or you stick to the products of drinking Highlight, Gatorade, Lucozade, or those and stuff that can give you electrolytes. Sometimes, if you don't have anything, you have look salt and little sugar, you can drop it in some water and mix it around, and that can help you build up your sodium level and help with rehydration. Malando. Malando.
Yes, I'm coming, Marshall. I'm working on it.
Okay, so we can just go and talk until put up the slide. Me show them the slide.
Yes, go ahead.
All right, so we look at hamstring injury from the perspective of the different types of hamstring injuries in terms of the grade of the hamstring injury. We look at strength exercise. We incorporate that from day one in the program. We look at flexibility and stretches also as a part of the program, and rehydration. Now, if we're at a meet and an athlete pick up a slight hamstring injury, as coaches, we apply the RICE treatment. I know now that it's a PRICE treatment, PRICE, but we use the RICE, RICE. Rest the athletes, we pull him from the commission, ice it 20 to 30 minutes. You can do it 2 or 3 times per day, even more. Compress, apply bandage to the areas to reduce, keep down the swelling, and elevate it. So restrict the blood flow in that area as best as possible. Now, that treatment is crucial. That initial treatment is crucial for the athlete on the day. And the rest part of it is key, because now that athlete pick up an injury, if you want to maximize his performance and you allow that athlete to compete on that injury, unless you have a medical personnel there at the venue as a part of your camp or part of your team, and the medical personnel says it's a championship, I think you can take the chance based on local therapy and run him. Fine. But if you don't have that sort of medical expertise on that time, and you're at a commission, and it's not a finals or it's a championship, best if you back out the athlete, withdraw him from the commission, then if he don't have any, if he has more events left to compete in, and get him healthy, that's have a better athlete at the, and can maximize his or her performance at the championship, than you run it to chance and get that athlete injured further. Get that athlete injured further and prevent him to go to the championship. So you apply the treatment. When you apply the treatment, then you go back home. You have a personal physio work with the team, or your team doctor, you're sending to the team doctor first, or the physio, and they make a further assessment. And based on their assessment, they will probably add some painkillers to his treatment to reduce swelling. And remember, again, I'm a coach, so we understand. Coaches don't give athletes painkillers. So the PRICE treatment or the RICE treatment is our first level of treatment for the athlete, unless as coaches, because we know you bring medical kits to doctors, they can give the athlete probably some Panadine or Panadol extra strength, which you can give the athlete for that occasion, and allow the doctor to probably to provide or to prescribe stronger medication for the athlete when him or her seen the next day, if he's not available to you on the same day. In terms of treatment, so treatment is crucial. The initial treatment is crucial, and from a coach's perspective, the RICE treatment, the PRICE method of delivering protect, rest, ice, compress, and elevate is crucial to help aid the recovery as quick as possible. Now, recommendation for the athlete to continue training is important, and you have to listen to your physiotherapist and doctor in this regard. Yes, athlete will come to you the next day and train and say, coach, me feel better and we not feel much pain in my hamstring. But that don't mean that he or she can really train that rigorously. So based on the recommendation from your physio or doctor, then you can determine the level of training and how much athlete can improve or increase his volume of training going forward based on the rest period. Now, for me, as coach, it's important that the prevention aspect of hamstring injury, you have to target your warm-up. Your warm-up will be more specific. That's to target muscle groups in your warm-up. That's to prevent the athlete as best as possible while he or she training or he or she is competing. Now, for me, I do 5 laps, for example, based on the athlete age of development. Gentle stretch, the drills, for example, butt kick, straight leg, high knees. We do some plyometrics as a part of my warm-up, bounding, jumping, windmill, and I do strides out, 650-meter sprints. So these sprints are to get the athlete muscles in tune to the exercise. Now remember, he's a jumper. So the bounding, the jumping, those exercises target certain muscle groups that he is going to do severe reps and reps and reps during the commission. So you have to target those muscle groups, target the hamstrings, target the hip flexors, target the quads, the calf. So each muscle is connected in general. Each muscle is connected. So you have to target those muscles and get the athlete warm up to meet a specific event, which in this case is a long jump. So a jump off a sprint on the runway. He or she normally runs 30 to 40 meters on that runway. Every run he run. So the 50-meter sprint is to target that level of sprinting. No, the 5 target is endurance capacity. And it also depends on the phase of the season. Because in the background part of the season, the GPP, you do some more long runs to build up general fitness that the muscle can cope with this pounding during the season. The plyometrics also have to be loaded over a period of time periodically for the athlete can manage these repetitions of jumps and pound on the body. So you have to target the warm-up during the course of the season, make the warm-up specific to the athlete event, in this case jumping, and target those muscle groups that the athlete can sustain over a period of time. Now, rehydration, which although I think I don't put that part of my presentation, rehydration is the key along with rest. Rest in the sense that when you're loading the athlete for those training each day, each cycle, each microcycle, you have to take into consideration amount of rest period that they get to recuperate from each session. So you go to training on a Monday, and the athlete do 60 or 70 jumps, 60 or 70 jumps overall during the whole course of the training session. Now, you have to consider that amount of jumps for Tuesday's training session, and which day in the week you're going to give that little rest period to recover from all the jumping he or she done Monday and Tuesday, for the body to can sustain that level of work on the body Thursday and Friday. So you have to take into consideration the amount of workload to give that during the course of a week. Keep in tune with the athlete, how the athlete feel, how the athlete is recovering, and recovery treatment can be outside of the ice treatment, can be either an ice bath or a warm bath or a massage. If you have massage therapists in a camp, you can get massages, or you can get an ice bath or something to help aid recovery that the body can sustain doing these exercises over a period of time without breakdown. A breakdown will naturally come, but it's how you give that this recovery period in each cycle of training. We make the athlete can recover from these impacts, daily impacts on the body, daily impacts on the nervous system during the course of the season. Can skip that, Marlon, but half of that.
Sorry? You have about 5 minutes. Is it time you asked me a while ago?
No, man. Anybody, just skip that slide. I think probably is the last slide, but if anything else,
okay.
Well, if anybody have any question to ask.
It is just about the right timing. And as you rightfully said, if anybody has any questions to ask, Mr. Barnes, are you with us? Mr. Barnes? All right, so I should have said this earlier, but as the presenters are presenting, if anyone has any question related to the presentation, they can put it in the chat. and I'll be looking through it, and I'll be asking the presenter at the end of it. So it's not too late. You can go ahead and put the questions in the chat. I have a few questions for Mr. Woolridge. All right, so Mr. Woolridge, thank you for the presentation. I particularly liked the importance you placed on rest. You know, I find that most times in my little experience that I may have, that I don't believe that the coaches really understand how important it is in terms of maximizing performance with the athletes if they don't pay attention to the amount of rest that the athletes gets. Are you hearing me?
Yes,
Ulrich?
I'm here now.
All right, so I appreciated that part especially. But what I wanted to ask you, and forgive my ignorance, is the warm-up, right?
Yeah.
I particularly like the warm-up, but what I want to know is the training itself for the long jumpers. Is it just the activity of doing the long jump? Because the warm-up seems a bit extensive to me. So I'm wondering, is that, or is it that would go over into a bit of the training itself? Because you have it on the warm-up.
All right. So, for example, it's about the quantity. So, warm up for a jumper. All right. So,
Yes.
you start a session at the do a little bit of gentle stretch. He drag 5 laps. No, he come back. He do some drills. No, the drills is the quantity. So you can mark out here of, say, for example, 20 meters, and you at least do 2 of each drills for 20 meters. So you do 2 high knees, 2 butt kicks. So it's not about the volume. So you complete all of this exercise. So it's a part of the warm-up process. Now the warm-up is a part of the training.
It isn't. All right.
No.
All
The
right.
warm-up is a part of the training itself.
Okay, understood. Okay.
No.
Yes.
So for example, on that day of the training, say you're going to do 30 full jumps. You're going to do 6 and 1-legged hops, 6 3-step, 6 5-step, and 6 full jump. Now, after done that, that would be the body of work that you are focused on technique. So what the athlete do in the period of executing that, you cool down, you stretch. Probably that's the session for the day.
Okay. Understood. All right. Another thing I wanted to ask you, I don't know if you mentioned it and I may have missed it, but hydration. You mentioned anything about that? How important is that to you?
Yes, I said that hydration is key, and I didn't put that part of the presentation because most time coaches think about injury and then don't look at the hydration factor as part of what causing the injury. So hydration and rest is a key part of strengthening the hamstring also. Yeah, you do put strength exercise in the hamstring, but how hydrated is the body is versus the amount of work it is doing, or how rested the body is. Because if the body is not getting enough fluid, injury will occur. No care how you straighten the hamstring, injury will occur.
Repeat that again for me. If you're not properly hydrated,
injury will occur. No care how straight you straighten the body, no care what else you do. If you are not hydrated properly, the athlete will get injured.
Okay. All
And
right.
I find that most times injuries first occurs because of dehydration. Dehydration and rest are the first 2 major factors of athlete being injured. Not getting enough rest, they must not get enough time to recover, and the athlete is not rehydrated properly.
Hey, you know, I must call me. Sorry.
Hello, who was that? All right, so I'm going to be going through a few of the questions, Mr. Worry. All right, so I'm seeing one here from, Joan Ratry.
Yeah, sure.
Says, how do you determine when the athlete... Somebody mute the mic. All right, so the question is, how do you determine when the athlete is ready to resume jumping following the hamstring injury?
All right, for me, it's about the dialogue between the physio and the doctor. So based on their recommendation, the athlete will start get light workouts based on their recommendation and based on therapy after a 1 or 2 week period. So based on the severity of the injury, based on the physiotherapist recommendation and doctor recommendation. After 1 or 2 weeks, we probably start doing light training, nothing severe, based on the recommendation.
Is there any specific test that you do to determine the readiness, or is just solely what they recommend?
All right.
The recommendation is
after recommendation coming, if the athlete come to training feeling pain in any sort of way, based on stretching, based on dragging, that you can use to determine as an eye test to not make them do some things. If they can do basic stretching, basic jogging without any pain, it means that anybody cannot go up to more rigorous activity.
There's another comment from John Campbell. He was saying that apparently you would have wanted to hear the significance of deceleration with regards to the hamstring injuries. He said that strong eccentric contractions predispose the hamstrings to injuries. So from what I'm understanding is when the athlete tend to be slowing down from probably a sprint, that's when they're more likely to. Is that your experience as a coach? Is that what you see?
All right. Well, deceleration is a problem when it don't done properly, and these are some things that are, for example, in training, we use cone. So when athletes, for example, running the 50 meter, we mark the 50 meter and then we add another 10 meter to that 50 meter. So although the 50 meter is the finish line, you don't stop until you pass 60 meter. You take your time, just like how you accelerate.
Okay, that's good.
You decelerate. So we use cone era to force them to not stop at the finishing line.
Right. Okay. All right. All right, I think that's all the questions I'm seeing here. All right, Mr. Woolery, I really appreciate you giving us the time, sharing the knowledge that you have with us. And we do hope that what we have learned will help us in our journey as sports med professionals.
You're welcome.
All right, so without further ado, I would like to introduce to us our second presenter.
Man, I need to see me jump up. Remember, see me a driver here?
Yes, man, I understand. I appreciate it, man. Thank you very much.
All right, boss.
All right, so I was saying our second presentation will be on hamstring injuries. Well, everything will be related to hamstring injuries with the long jumpers, but we're looking at the aspect from the eyes of the physician now in terms of their management. This presentation was prepared by Dr. Lincoln A. Cox. Let me tell you a bit about him. He is a general and vascular surgeon. He works at the Savannah Lamar Hospital. He's also an associate lecturer at the UHWI. In my own word, he has a plethora of experience in sports medicine. He has been the team doctor at a few of the IAAF World Relays, IAAF Under-20 World Junior Championship, IAAF World Youth Athletics, just to name a few. And he's also presently with the National Jamaica football side in Japan. So he has asked his colleague, Dr. Shebiki Beaton, to do the presentation for him. She's a resident in Gen Surg as well for 3 years. She also has a little bit of experience. Could you mute her mics, please? She also has a little bit of experience in sports medicine herself. She's from Guyana, and that's where that experience was. So we're looking forward to having her join us here to be a part of our Sports Med Association here in Jamaica. So without further ado, I'm going to ask her to present, and I'm going to ask you to give her your undivided attention. So Dr. Beaton.
Yes, good afternoon again. Thank you for having me. As you would have said, I'm filling in for Dr. Cox, who is unfortunately not able to present for you today. However, he did prepare the presentation, so I'll just like to briefly go through some hamstring injuries, basically from a medical standpoint. right? So just a little background. You guys are seeing my screen?
Yes, yes, we are.
All right. Just give me a second. I'm not sure how, oh, there we go. Right. So just a bit of introduction. Ms. Kivona Davis, right? 15-year-old Jamaican, in Nairobi, Kenya in 2017 was participating in the IAAF under 18 World Championships, and she suffered a hamstring injury just 5 meters from the finish line. She was able to complete the race and she was able to win a bronze for Jamaica, which is well done. But although some hamstring injuries, persons can complete the race, some are not so lucky. So I'd like just to go through this presentation to give us a better appreciation of the severity of hamstring injuries and maybe some of what we can do to prevent it and how we basically manage these type of injuries, right? I just have a short video. You guys, most of you should be aware of this video already. So just like to play. It's taking a while to load, just bear with me. I know some of you are in tears right now. It's okay to stop crying. But yes, Usain Bolt did suffer a hamstring injury. And unfortunately, he was one of those who was unable to complete his race. Progressing. Typical position of somebody who would have experienced a hamstring injury, often grabbing the hamstring, writhing in pain. Sometimes we can see more clinical symptoms like the area starting to get red or purple. But initially, this is what it looks like. So somebody on the sideline, even not even a medical doctor can say, you know, this person seems to have a hamstring injury. This is another little video. In this video, there is not none of the athletes sustained any of the injuries, but this is one of the typical sports: long jump, high jump. Long jump, high jump, sprint, yes, where athletes can sustain a hamstring injury, and it's basically because of the mechanism of the sport. So when there is flexion of the knee and extension of the hip, these sports where persons have to do a lot of that, that's where you more likely experience a hamstring injury. So if you could just look at the form.
In the difficult conditions in New York, but the wind gusting in the faces and behind the athletes resulted in some big jumps. Rishwai Samai of South Africa, with very little international experience, garnering third place with his round 3 effort of 8 meters exactly. That with a 2.2 following wind, putting it just over the limit. Big names like Geiser and Satumas really struggling with the conditions. We're a long way shy of 8 meters. Christian Taylor, though, the multi-talented Olympic champion in the triple jump, was jumping well here today in round 5, going up to 8 meters and 6 centimeters. Again, with a 2.2 following.
Right. I'm trying to move on here.
Wind.
Right. So in general, approximately 1/3 of all musculoskeletal injuries in track and field are hamstring injuries. However, this is much higher in sports like soccer, where the majority of musculoskeletal injuries are actually hamstring injuries. And there's attached to the presentation, I'm not sure if this will be shared with you guys. There's some review articles where you can read up and get more information of this. This is basically statistics, however. Now the image here. Right, so let's talk a bit about the hamstring muscles. Right, so these are your posterior thigh muscles. They're basically three muscles that make up the hamstring. There's semitendinous, semimembranosus, and the biceps femoris. And the biceps femoris has two heads, basically. There's a long head and the short head. All of these muscles originate from, the origin is basically from the ischial tuberosity that's on the hip, at the base of the hip, and they attach either laterally on the fibular head or medially on the subcondylar area of the medial leg, right? So this is a image, basically. You guys can see my cursor?
Yes.
Right.
Dr.
So,
Peter, are you able to turn up your volume?
Oh, it's up.
I'm hearing you clearly, but some persons aren't.
Not hearing?
Well, I'm hearing you clearly too. I think the persons on the other end need to turn up theirs.
Okay, all right. Go
ahead. It's coming loud and clear.
Yeah.
Okay. All right. So you won't be able to see the bony structures on these images, but it's basically the ischial spine is somewhere here. You can actually feel it sometime when you're trying to sit. You can actually feel the prominence of that bone right there. So it's somewhere under here. And this is basically where the muscles originate. And they would come down here. And this is actually the medial aspect of the leg. And this would be under the tibial head. The tibial bone is this way. And then the fibula is lateral, right? And the lateral is where the biceps femoris, long and short head, would attach, right? So you would see the short head here because this one starts a bit low. It doesn't start at the ischial tuberosity, which is here, right? It starts along the femoral bone, right? It's actually a line here that it's a medical term, but there's actually a line of attachment here from a lot of muscles in the thigh, and so this is where the short head attaches, right? So this is a better picture where we basically remove most of the muscles, and you can see. So this is the fibula, and this is the tibial bone, and this is where the ischial spine. So this is the origin, and this is the point of insertion. Right, and you can see here is the knee. So basically you can get a better appreciation of the anatomy of the injury. Right, so these are all diagrams depicting just what I would have said before. All right, so as I briefly would have said before, the hamstring basically works in flexion of the knee and extension of the hip, right? So all the muscles are involved in the flexion of the knee, but the short head of the biceps femoris is involved in the extension of the hip. And because it works on both the hip and the knee, we call it biarticular, basically working on two joints. Right? So here you can see the hip is extended and the knee is flexed. And this is the typical position of athletes when they would sustain a hamstring injury. All right, so mechanism of injury, right? So there are different ways in which you can sustain a hamstring injury. It can be direct. For instance, as you can see here, in this football is basically kneeing the hamstring of the athlete here, right? Or sometimes it can be indirect, so from distension or strain injuries. Now, Charlie horse, that's basically a muscle spasm of the hamstring. It can be of any muscle group, but in relation to the hamstring, or in relation to the hamstring is basically when you feel a severe sort of cramping in the leg. I know many of athletes would have actually expressed having this before, and coach would have highlighted before that some ways in which you can have these kind of injuries is if you don't adequately hydrate, if you don't have your electrolytes are not well balanced. This puts you at a greater risk of getting these kinds of muscle spasm, right? Sometimes you can recover quite fast, it lasts about a few minutes, but sometimes there's a severe pain afterwards, and that may take maybe a few days to actually to resolve. Now, this diagram actually depicts a cork thigh. There's supposed to be a T here, a cork thigh, and that's when there's direct trauma of the muscle group against the bone, right? So this would be the athlete kneeing the other athlete here. In the hamstring, the hamstrings will now be compressed against the femoral bone. Other than football, it can also occur in sports like cricket, where the cricket ball is very hard, and even golf, well, no, not golf, polo, where the ball would be very hard and it would somehow strike the muscle group in the athlete. And so when the muscle is compressed, basically there's a lot of trauma there. There can be bleeding, bruising, and that's how you basically get a cork thigh injury. Right? As I said, majority of football injuries are hamstring injuries. But in terms of track and field, it usually occurs at the maximum sprint phase, right? So when there's a late swing phase of running, just before the heel touches the ground, this is where the athlete is at greatest risk of sustaining a hamstring injury. This is just a depiction of the different phases here. And of course, we have Usain Bolt at the top. Sorry, I'm having a bit of, sorry. Right, so again, just to describe the position, the knee is flexed, the hip is extended, right? High jumpers. This hamstring injury is usually referred to as a hurdle injury. And that's because persons who have to do high jump, long jump, they usually have, would sustain these injuries as well. Although I did say that soccer, football has the greatest incidence, but that's basically because of the burst in speed that they would usually have to do most of the time. So there's a mechanism, basically depends on the nature of the sport as well. But as you can see here in these hurdle jumpers, right, you can see the stretch, fully extended hip and flexion of the knee. And this is basically what they're doing in addition to moving very, very fast. So they are at increased risk. And as I go on in the presentation, you would see it's in addition to the position, it also is based on other factors like the speed and trajectory of your muscle groups in the athlete, right? So impact of hamstring injuries. For our athletes, this is basically what they're interested in. It can range, it can be mild to severe, but usually in the severe injuries, there's significant morbidity. And this is mainly because of pain and of course, decreased range of motion of the hip and the knee, right? So you would experience significant pain. You can have decrease in performance. Of course, when you sustain a hamstring injury, we'd expect that you would give yourself some time to rest. and that would result in time lost from the sports, and a lot of athletes won't be happy with that. But we have to think long term, and for the health of the athlete, and for the future progress, we need to take time to rest and take time off from the sport so that the muscle can heal properly, right? So of course, decreased squad or team availability. There's also increased costs because, of course, we have to now involve rehabilitation, and depending on the severity of the injury, of course, sometimes there's a medical cost attached, even for simple things such as painkillers to relieve the pain for the athlete. It decreases likelihood of success playing with a hamstring injury. However, as I said, depending on the severity, we would advise time off of the sport so that you can recuperate properly. But when you sustain one hamstring injuries, it actually puts you at risk of getting other hamstring injuries, as we will discuss again further in the presentation. So risk factors for hamstring injuries. Basically, any age, once you're involved in sport, you can sustain a hamstring injury. However, the severity sometimes, or the type of injury that the athlete can get, would be based on the age. For instance, there's a particular injury, the avulsion injury, where the part of the ischial tuberosity, that's where the muscles attached on the hip, actually becomes torn off, piece of the bone. And those injuries are more common in young athletes and teenagers. So that's based on the fact that their bones are not as mature as older athletes, more seasoned athletes, and they would definitely suffer a more severe injury in terms of a hamstring injury. Now, as I said, previous injury also puts you at risk of getting another injury. If you have any condition which would cause a reduced range of motion in the hip, or if you have poor hamstring strength. And that's where strength, hello?
We're here.
Oh, okay. And that's where strengthening your hamstring, strengthening your muscle groups would come into play. I know coach would have mentioned something a bit about that before. And also pre-game warm-up, very important, right? It has been found that Black people are at an increased risk of sustaining hamstring injuries. And that's because well, according to the studies, we're able to achieve higher running speeds. And as I said, the faster you go, the more chance of you getting a hamstring injury, right? Gender as well. It's actually, some studies actually say that men are about 65 times more likely than women to sustain hamstring injuries, right? So I guess this should be important information for our coaches so that they will be able to observe the athletes in a bit more, the male athletes, in terms of hamstring injuries. And of course, this is because the muscle strength in the hamstring, generally because of the testosterone, men are able to achieve higher running speeds and basically better development or more development of the hamstring muscles in some aspects, right? Not saying that women can't achieve the same, but generally, the men tend to have these complaints more than females, right? As I said before, superior running speed. If you have any form of musculoskeletal precondition, these can cause, like if you have joint pain, back pain, if you strained your muscle before, these would increase your chances of getting a hamstring injury. Muscle fatigue. A lot of times we forget that we need to put into our body what we want to use up, and these basically, in terms of electrolytes, that's what would put our muscles at greatest risk of being injured. So I like the fact that coach would have emphasize the importance of hydration, adequate hydration, and not just with water, because you don't want to just put water into the system, but you during exercise, sorry, and sports, we basically use up our electrolytes, sodium, chloride, potassium, and what we use as fuel for our body is basically phosphate. And we need to ensure that we get all of these electrolytes, even your macro, sometimes even something as minor as zinc. So we encourage supplementation for athletes, especially if you're doing a lot, if you're tasking your body a lot, you need to be able to replace all of these electrolytes so that when you're ready for a game, you're ready for an event, you're at your peak performance and your body is able to work with you. You can't push your body beyond what your mind is able to do. Your body, yes, I said it the right way. All right, so diagnosis. Just give me 1 second, please. Sorry. Good afternoon.
All right, everyone. I just want to say that remember that this is being fed to the YouTube feed live. So those who are watching via YouTube as well can leave their questions in the comments, and at the end of the presentation, the presenter will answer the questions as much as is possible. Likewise, via the Zoom,
no, it's PD.
questions in the chat. Thank you.
Yes, sorry, I apologize for that, but I'm currently on call, so just got a call up from the hospital. Sorry about that.
Understood.
Right. Yeah, so diagnosis. Basically, for any case, hamstring or not, we would do a history, observation, examination, and sometimes we would order radiological investigations based on what we're suspecting, right? So this is basic, right? So the history. So that's very important. Sometimes the history in itself can give us most of the information that we need about the condition, or what's happening with the patient, right? So the patient can come in complaining of severe pain on high-speed running. So we want to know, what were you doing at the time you sustained the injury, right? So this will give us a better understanding of the extent of injury as well, or what would have happened. So if severe pain on high speed running in the region of the hamstring, if they were sprinting, if they were doing something like a long jump, right? If they were turning or kicking, this is important, especially for the footballers, high kicking, glide tackling. Sometimes if in stretching or splitting. And of course, this is very important because most of the times it has a sudden onset. So when there's a burst of activity and then sometimes they experience a severe pain, or in more serious injuries, some athletes would actually hear a pop, have a popping sensation, right? I guess it may be difficult for some of us to understand because it wouldn't have happened to us, and I guess you would it's of a sensation and of a hearing the pop, right? The severity of pain it varies based on the extent of the injury. So not everybody will come complaining of the same amount of pain. As I said, some athletes are able to complete the race, while some have to literally drop out because of the pain. Will be writhing in pain on the floor and so forth. So there's some simple maneuvers that we can do. I won't basically go into all of that, but most times when we see a patient, especially an athlete walking in, we can tell, this person more than likely would have sustained the hamstring injury. And that's because there's something called an antalgic gait. That's where you try you're not putting any weight, you're not weight bearing on the affected limb, right? So basically it's somewhat of a limp. Right, so just looking at that sometimes and looking at the patient grabbing the hamstring, we can tell, of course, that's the location of the pain and what type of injury they would have sustained. Right, so all of these tests are basically medical, you can go through them, but basically for the purpose of this presentation, I will just say the antalgic gait. Sometimes we can notice ecchymosis, which is a purplish discoloration of the area of the muscles. It's superficial, so it's basically on the skin, but it basically signifies that there would have been some bleeding there, rupture of vessels, and there would be bleeding under this the subcutaneous tissue. Now, it of course would be easier to see in light athletes or patients who are of lighter complexion, but it can be seen in darker athletes as well. Of course, there would be swelling. Sometimes, depending on if there is a complete rupture of the muscle group, you can actually see that there's a bulge in the posterior thigh area. That's basically because the muscle would have been separated completely, and you can actually feel that bulge in the lower part of the muscle there. As I said, the mechanism of injury is basically when there's a combination of hip flexion, and the knee is, hip is supposed to be extension, but then the knee is fully flexed and hip extended. Tearing, popping sensation, severe pain, loss of function of the joints, and extensive posterior thigh bruising, which is ecchymosis, as I would have mentioned, right? And there's also pain and palpation of the ischial tuberosity, and that's basically if there is which is most often if the injury would have occurred at the insertion of the hamstring muscles, which is on the ischial tuberosity, right? This is all basically going through again what I would have said about the type of injuries and the presentation signs and symptoms that we would notice in hamstring injuries, right? As I said, high speed sprinting, loss of function, bruising would be present, and sometimes you can feel the palpable bulge of the muscle in the thigh. And this is basically what I'm talking about. So this is ecchymosis. So you can see it's a bit purplish. And this is basically because there's bruising and bleeding into the subcutaneous tissue here. And this is what it looks like, right? And the bulge, what I would have mentioned here. All right, so sometimes we don't need, it's not often that we would need radiological images to confirm a hamstring injury, but it does help in determining the extent of the injury. X-rays are not good at determining extent of soft tissue injuries. We usually use them for when we suspect bony injury like fractures. However, there's a particular type, and especially in children, we would want to do X-rays because they can sustain the avulsion type injury. That's where part of the bone is where the tendon attaches would be removed. That would basically be cracked and slip off. So we can see that fracture clearly with X-rays. We can use ultrasounds, but MRI is the best mode to determine the extent of all soft tissue injuries, and this would include hamstring injuries, right? So we have the ischial tuberosity here, and sometimes there will be a fracture here at the ischial tuberosity. Right, and this is basically what I would have said. In younger athletes, they're more prone to having the avulsion type injury. In ultrasounds, sometimes they use this bedside, but it's not quite ideal. Sometimes you can actually see bleeding between the muscle, the fascia of the muscle, and that could tell you that there's some rupture of muscle there. An edema, but it's not really as effective as the MRI. So this is actually an MRI image here. So it's easier to see blood. You could actually see blood in all of these vessels here. It's a lot easier to see bleeding on MRI images and soft tissue swelling and edema here, right? So you will see that this is basically a hematoma in the leg, meaning a collection of blood, which would have accumulated after the muscle injury there. And you could actually be able to demarcate where exactly the injury is in the muscle group. So this is gold standard. Coach would have briefly mentioned this, but it's usually 3 grades of hamstring injury, from less severe to more severe. The grade 1, which is a muscle tendon strain. And most of these hamstring injuries will occur at the upper part of the muscle. So that would be most closer to the insertion site at the ischial tuberosity. The lower hamstring injuries are a lot less common. There's grade 2, which is partial muscle tear, and grade 3, which is a complete muscle tear, or sometimes plus or minus the avulsion. Well, the muscle tear is usually at the belly of the muscle, so it's basically more to the center. And with the tendon injury, as I said, it's mostly at the top superior aspect of the muscle group. Sorry, can you just excuse me for not a few minutes?
Sure.
Yeah, doc. How old is she? 107? And she's hypertensive? She's hypertensive? And tell me where's the also? And the toes are affected or just at the ball of the foot? On the diaphragm. Yeah, send me a picture. What's her name again? But her GMR is 11. Right, what's her name again? All right, thanks. All right. All right, no problem. I'll message you in a few. Yes, sorry about that again.
Okay.
All right. All right, so I'm gonna try to move along a bit, and I know I've been here for a while, so let me try to move on a bit because I have a patient to go see. But location of injury, the origin, as I said, of the muscle groups would be the ischial tuberosity. This is where you would experience most of the adult avulsion. Yeah, most of the avulsion type injuries, especially in the adolescents and the younger athletes. But however, if it's a proximal free tendon, that's usually the worst prognosis. So basically, proximal region, basically at the upper hip, would have a worse prognosis, right? The distal free tendon is a lot less common, but If it does occur, the muscle semitendinosus muscle is usually most affected. Of course, the semimembranous can be affected too, but that one is particularly more affected. Now, in terms of what this would mean for ambulation for the patient or the athlete, it's not it doesn't really have much significance in terms of how severe it would be, or in terms of recovery time, basically, or how the patient would feel, or they won't be able to determine based on how the muscle feel, basically where the injury is. And as I said, these muscles collectively work to flex the knee, extend the hip. So basically, injury in one would affect more or less the entire function, or the collective function of the hip and the knee, especially where pain is involved. So this image here would basically describes the grade. This is a grade 1. So there's you can't even see a tear in the muscle fibers here, but definitely there will be strain there in the muscle. So that's depicted by this reddened area here. So the grade 2 would be a partial tear. So you can see it doesn't extend all the way through the muscle. And then the complete tear would be a grade 3 injury, where it extends all the way through the muscle. And for the avulsion type, this is avulsion type. So you can see here that the bone is actually separated off here. The nerve that supplies this area is basically the sciatic nerve. And sometimes because of the innervation of this nerve, what we want to ensure is that we preserve the nerve, especially when surgery has to be done. Preserving the nerve would be most important in maintaining the function and sensation of the limb, right? The avulsion type, as I said, this is the ischial tuberosity. It attaches here, and this would be if there's a tear in a fracture in the bone. Sometimes we can do something called pinning. So these are basically pins where they would attach the tendon, which would be right around here, the tendon of the muscle back to the ischial tuberosity. So this would be the tear here in the tendon, and they would insert these pins for repair. And of course, these injuries will take a much longer time for recovery. All right, so this is just another image here. This will show a grade 3 tear. This is complete. This will be complete tear of the semitendinosus muscle. Right? Again, and this will be of the long head of the biceps femoris. There are some different grading systems based on the MRI images, but I won't go through this. But you guys can, if you guys get the presentation, you can get to go through it. All right, so treatment. Of course, this will depend on the grade of the injury. RICE is first and foremost, so you want to rest, ice, compress, and elevate. And of course, this would be to decrease the pain and swelling to the area. Depending on the extent, especially if there is grade 2 to 3 injuries, surgery may be indicated. If there's an avulsion type, surgery is definitely indicated. Of course, you'd want to decrease weight bearing on the affected limb, use of crutches, wheelchairs, so forth would be ideal. Sometimes if there's a large hematoma, meaning there's a lot of bleeding from the muscle tear, we can aspirate. Sometimes as well, this can get infected if there's a large hematoma. There, especially if it's associated with some break in the skin, or even if not, there can be infection of the hematoma, and that of course would cause a delay in healing of the wound. Right? Injection of platelet-rich plasma, not often done. That doesn't have to be done always, but this is another treatment that we can actually bring on board in aiding in this recovery. Re-injury rates after you suffer the hamstring injuries are highest during the first 2 months. So we'd want to encourage at least depending on the severity, of course, especially for the most severe injuries, at least 6 weeks off of the limb, depending on how well the muscle is healing or the injury is healing, and how effective physiotherapy is. The time can be adjusted. So this is basically something that we would do based on observation and basically observing how the athlete progresses with physiotherapy. So we can be able to tell how soon the athlete can return back to sports. Prognosis, there, of course, expected to be better prognosis with lower grade of injuries, can range from 2 to 6 weeks for your return to sports. Proximal injuries usually have a worse outcome, and of course the avulsion type injuries as well. Injuries of the long head of the biceps femoris or its insertion increase the time for you to return. So if the biceps is affected, because this is basically the major muscle group in the hamstring, you would anticipate a longer time for the athlete to be able to get back on their feet. Right? Avulsion type injuries, as I would have said, and if there is more severe, well, this is basically based on the MRI grading scale, but more severe injuries, of course, would take a longer time. Chronic injuries, sorry. So if a person gets repeated injuries, or if there is chronic strain on the muscle group, then of course they would take a longer time. Sometimes the patient may experience pain for months after the injury, and decrease of range of motion in the limb. Sometimes surgery is indicated, not every time, but of course this would be for the most severe injuries. And this basically brings me to the end of the presentation. I know I was rushing it a bit, but as I said, I'm still on duty now, so. Hello?
We're here.
Right.
Thank you very much, Dr. Beaton. It was
You're
very
welcome.
informative, and I really appreciate that you took the time. So we don't want to keep it too long, so I want to quickly look and see if we have any questions in the chat. And Mr. Barnes, do we have any questions on the YouTube?
No, not right now.
All right, so let me ask you a question, Dr. Beaton. And it's just out of my curiosity. Like with an, for example, an athlete may have a fracture, right? And,
okay, yeah. The avulsion type?
No, I'm just giving a
regular
comparison.
fracture.
Just
Okay.
came to me. Yeah, that usually when you're after a certain time period, and I guess you want to see the how well the athlete is doing. Normally, a repeat X-ray may be suggested to look at the bone and see how well it's healing, right? Just out of curiosity, the outcome measures you were saying for the athlete with the hamstring injury, for example, you were saying that you would look how well he's doing with physio, observe how he moves, and so why is it that doctors never really say, all right, let's get an MRI done now to look at how well the muscle has healed?
Okay, so sometimes they do, but ordering, yes, sometimes they do. Ordering an MRI, for one, I would say MRIs are very expensive. It sometimes it's not available to every patient. right? In a system where it's readily available, more than likely we could order repeat MRIs, but sometimes it's not necessary. For instance, if you would have had an initial, suppose you did an initial MRI, right? Or even if you didn't do an initial MRI and from the examination of the patient, the injury just seems to be a strain, right? The athlete is able to not suitably weight bear, but is able to maintain some form of range of motion of the leg. You don't suspect that there's any complete tear of the muscle, right? We may not go directly to order the MRI, although it's the best and gold standard. Of course, for those athletes who are, well, the more popular athletes who are able to afford all of these things too, they can just choose that, you know what, I want an MRI, or even their coach or their team may say that, we want an MRI for this just to ensure that we know exactly what's happening. Yes, sometimes it's not necessary, but based on the presentation, we may order. And this goes for majority of the tests that we would order. Not every scenario would necessitate us ordering the MRI. So for instance, if you would have a less severity of injury, you won't want to, you don't think that it's necessary for the MRI to be repeated, because it basically won't affect your management in a sense. And what doctors would like to work on in principle is that we don't treat images, we treat the patient. So if the patient is improving, physically with physiotherapy, and you can see that they're regaining their range of their function of the muscle group and of the limb, why would you want to repeat the MRI for it to tell you, oh, there's still a part of a tear there and so forth, when the patient himself, right?
Because I'm
So
thinking sometimes the results of the MRI doesn't correlate necessarily with how the patient is presenting.
Right. So they're different things. Mostly it's basically we treat the patient. Yes, we can order MRIs. Of course, if a patient says, you know what, I want an MRI, the patient is basically, the patient has a right to, and we can order it based on the request of the patient as well. But in general, it basically it depends on the type of injury and how well we see that the patient is recovering. So it's not always necessary.
Thank you. One more question I see here from Joan Rachi. She's asking, what surgical procedure is done to repair the injured muscle?
All right. So I would say I have never seen, we've never done it here. At least I've never seen it so far that we have done, but it depends on where the level of injury is, right? So we can actually open the leg, and we can actually just reattach the fibers of the muscle with sutures, right? If there is depending on where the tear is. Sometimes you don't even have to repair it surgically, depending on the extent of the tear, right? So we can actually suture it. And if there is avulsion from the tendon and the bone, that's where they actually insert some pins, because the tendon is a fibrous material. It is not really, simple sutures won't work on that really, especially from a big muscle group. So that's where pinning would be involved, and that's mostly like an orthopedic type of surgery. So general surgeons, not really.
All right, Dr. Beat, and again, I say thank you very much. And I know definitely that we've benefited from the time you've shared and the information that you provided for us. And thank you very much.
All right, you're welcome. It's a pleasure to be here with you guys.
Thank you.
All right.
All right. No questions from the YouTube, right, Mr. Barnes? All right,
No.
so we're gonna move straight to our third presenter. The presentation that he'll be giving us is titled Rehabilitation of Hamstring Injuries and the long jumpers, of course, and I guess other athletes. Once we hear the term rehab, I know that we can't say rehabilitation without thinking about the physical therapist. So the presentation was prepared by a physiotherapist. His name is Dr. Kevin Christie. He's the founder and lead physiotherapist at Quality Rehab, which is located in Montego Bay. She has 2 offices. He's a member as well of the Sports Med Association, which I should have said that presentation that Dr. Beaton did, which was created by Dr. Cox. He's also a member of the Sports Medicine Association. So as I was saying, Dr. Christie is a member. He also has a vast experience in sports medicine himself. He has been the team physiotherapy for the Montego Bay United Football Club, 2016 to present. He's also the team physio for his alma mater, which is Cornwall College. He's also a team physio for the senior men's team, which he is presently with in Japan. So he himself was not able to do the presentation for us. So he had asked his colleague, which I'd like to introduce briefly as Andre Doyley. He's also a physiotherapist. And we appreciate that he was able to fill in for us. He specializes in, he has a vast experience in functional and kinetic treatment with rehab. And he also shows a keen interest in sports medicine. So I believe he'll be a part of our membership soon. So without further ado, I'm gonna ask Andre Daly to present, and I'm gonna ask you to give him your full attention. Thank you. Andre Daly. Andre Daly. Hello? Anyone here? Everybody's hearing me?
I'm hearing you. Let me make sure he can come off. Oh, he's coming back in. He's out. Like he looked like he got logged off, so he's up. All right, Mr. Daly, you can share your screen as you did before. Okay.
Good afternoon, everyone.
Afternoon, Mr. Daly.
Just give me a second, please. All right. Can everyone see?
Yes, we're seeing
Yes,
your first slide
we're
now.
seeing.
Yes.
Okay, awesome. So good afternoon again. So today I will
Afternoon.
be presenting on the rehabilitation of hamstring in long jumpers. All right, and some of this information is just a reiteration of what has been said before. So just please bear with me. All right. So moving forward, we'll have an introduction. We'll talk a little bit about the anatomy, etiology, differential and clinical diagnoses, the hamstring strain and athletes, the stages of long jump, post-injury rehab, research data, and conclusion. All right. So hamstring injuries are very common in athletes. And when I talk about hamstring injury, I'm specifically referring to the strain of the hamstring, which may either be partial or complete tear of the muscle fibers, and a grading scheme is attached. Acute hamstring strains can occur with high-speed running or with excessive hamstring lengthening. Now, acute hamstring strains are the most common muscle strain. They have high rates of recurrence and can lead to prolonged absence from sports. Some studies have reported that almost 1 in 3 hamstring strains will recur, and many happen within the first 2 weeks of return to sport. The evidence suggests that the chance of re-injury to the hamstring occurs in 34% of cases. As Dr. Scott Morrison says, most injuries occur from doing too much, too fast, after doing too little or too long. Sorry about that. All right, so we'll talk a little bit about the anatomy. All right, so the hamstring comprises of 3 major muscles: the biceps, long and shorted, semitendinosus, and semimembranosus. All right, and most of them, well, all of them rather, originate from ischial tuberosity in the rear of the pelvis, and all the muscles are innervated by the sciatic nerve. So most hamstring injuries in adults occur at the musculocutaneous junction, but injury may also occur at the insertion of the ischial tuberosity. Severe hamstring injuries where the tendon tears away with a fragment of bone are called avulsion fracture injuries. These are not common and typically occur in patients who are younger, skeletally immature athletes. Now, the biomechanical role of the hamstrings. So the hamstrings, sorry about that, the biomechanical role include knee flexion or bending the knee, that is heel towards the glutes, is contracting the hamstring muscles. Knee extension or straightening of the knee is the eccentric contraction of the hamstring muscles. Now, hamstring strains are graded according to their severity. You have grade 1, 2, and 3. And in grade 1, small percentage of the fibers are stretched or torn, mild pain, and you have minimal to no loss of strength. In grade 2, you have significant percentage of torn fibers, swelling, pain with active range of motion, loss of strength, palpable deformity. And grade 3, you have complete tearing of fibers and or muscular tendinous junction, gross impairment, and severe initial pain. Now, it is a well-known fact that if we want the maximum potential out of a muscle, it would have to go through maximum stretch to produce maximum force. So some of the most common factors of strains are poor flexibility and strength imbalance between quadriceps and hamstring muscle groups, inadequate warm-up techniques, previous hamstring injuries, overexertion or excessive stretching, and muscle fatigue. Muscle fatigue is also thought to play a major role in contributing to muscle damage. Now, the history and physical examination are essential when treating an athlete with suspected hamstring injury. Misdiagnosis of hamstring strain injuries is common, leading to incorrect management techniques that can exacerbate the injury or prolong the recovery period. This is
Darley, sorry to cut you, but the
preventative techniques to decrease the chance of a hamstring strain are very important in professional sport.
Darley.
Hello?
Yeah, it's sounding very muffled, so I don't know what changed. It was clear initially, but now it's kind of sounding muffled.
Sorry, give me a second. I don't know what happened.
Yeah, it still sound the same.
I don't know what happened. Sorry.
All right, go again, Amir or someone.
Check your audio connection.
Are you hearing me?
Yeah, man, much better now.
Much better?
Better.
Yes.
Everyone clear?
Nope.
Right. So I was talking about the
Hold on, Darley.
yes.
It went back to the same way it sounded not too long. What's the difference?
Hello?
Are you closer to the mic now when you're speaking? Because that's clear now. And then you,
Yeah,
when you
and then when
start
you go back to the
present,
presentation, it's muffled.
Hold on.
You're clear
That's
now.
clear.
Like how you are, you're clear.
You guys are better now?
It's not the picture, no, Darley. It's your volume. It's your tone.
I'm not sure what's happening.
All right, you sound good now.
I'm not sure what's happening.
You sound
You're
good now.
clearly there now, darling. So I think it has something to do with the position of the mic to your mouth or to your mouthpiece that you're speaking into. So the video is fine. The video is fine. It's just the audio.
All right. Can
So
you
you're
hear me
clear
now?
now?
You're clear now.
All right. Awesome. Awesome. Awesome.
All right, good.
All right. Let me get back to the presentation. I'm so sorry about that.
Everything is all right, Mr. Darley?
Oh, he's come. You let him back in?
Hello?
Yes,
Yes,
we're hearing you.
we're hearing you.
All right. Awesome. Let me just get back to the presentation. I'm using my phone, so it's a tad bit tricky.
I recognize that. Just make sure you're speaking into the microphone part of the phone. You sound clear. You sound clear earlier when we had practice, and then you started out clear, and then as you went along, your voice starts to get muffled as if you're not speaking into the microphone part of the phone. So if you have a headpiece on, then make sure you hold the mic to your mouth.
Okay, no problem. Let me try and log back on.
All right, while we're waiting for Andre to put his presentation back up, just remember if you log back in, if you get put out and you get readmitted, to remember to mute your mics. So we don't have, I can try and track them as best as I can here. Every once in a while, somebody comes back in and the mic is on and we're getting background noises. So remember, once you're on, everyone, just make sure that your mic remain muted.
Yeah, darling.
I just try to get Andre back in again. And
Knocked out again. So, darling.
it just come back in. So
Yeah. Boy,
all right.
technology failed me a while ago.
Everything up now?
Yeah. I'm just going to share the screen.
Okay. Waiting
All
for
right.
you.
See me now?
Well, it's coming. You say that you're sharing, what is that? The screen. Yep, there you go. Presentation backup.
All
So you
right.
can go to where
Awesome.
you left off.
All right. All right, good. All right. So as I was saying, we're talking about the differential diagnosis, right? And so preventative techniques to decrease the chance of a hamstring strain are imperative in professional sport. Now, the sciatic nerve passes through the hamstring muscle group, and therefore an injury to the lower back may refer pain to the hamstring region. Delayed onset muscle soreness is commonly mistaken as a strain. However, the symptoms develop 24 to 72 hours post-exercise, then disappear. a strain results in immediate pain and functional deterioration. Then we move on to the clinical diagnosis. Now, referral of any hamstring distress is vital for establishing correct treatment options and preventing further injury. Now, diagnosis involves an evaluation of history, the type of action or activity performed, and physical examination. Now, MRIs may be conducted to establish deep intramuscular strains or tearing of the hamstring. Now, here we have a table showing the likely results of an ultrasound or MRI based on the grade of injury. And as you can see, in a grade 1 strain, the MRI will be negative. There will be no structural damage seen. You may have some muscle edema with or without hemorrhage. In moderate, you may have a MRI positive with tearing less than 50% of the muscle fibers, possible focal defect, partial retraction of muscle fibers, and in a severe case, you may have a muscle rupture with 100% structural damage, complete tearing with or without muscle retraction. Continuing, the following physical examination techniques are commonly performed when diagnosing hamstring injuries. We have the straight leg raise, which is a passive leg raise with straight knee. You have a normal range of motion between 80 to 90 degrees. Pain may be reproduced and comparisons are made between opposite limbs, sorry. You have resisted knee flexion, wherein passive resistance is given as the patient bends the knee. Now, this may cause pain on hamstring contraction. Now, the strength of the movement is also compared to the opposite limb. The slump test is also used, and this is used to determine if there's any neurological involvement. The patient straightens out one leg, bends head downwards, and points the toes upwards. The stretch is enhanced by pushing the patient forward. Now, symptoms such as pain shooting down the leg is a positive indication of neural involvement. Palpation is when the physician touches the patient and, well, that is used to detect any deformity, pain, tension, or hole within the muscle belly and associated structures. Now, hamstring strain and athletes. High-speed running requires eccentric strength when the hamstring muscles are in a lengthened state. Now, the lengthened state occurs when the hip is in flexion and the lower leg moves into extension, thus lengthening the true hamstring muscle over both articulations upon which they act. There is also evidence to suggest that athletes who have sustained a hamstring strain lack strength when the muscle is utilized during performance in a lengthened state. Here we have a video. See if it plays. Just give me a minute. All right, so it's not playing, but basically it's a video showing a long jumper running up to the board, and before he takes off, he just runs through the sand because apparently, you know, he would have felt something, right? So the stages of long jump. Now, can anyone guess which aspect the athlete will pull upon? Anyone, depending on any of the factors which I had mentioned before? No? Anyone?
Just when he's entering flight.
All right. So can you see my point, my mouse?
Probably mid-flight.
Right.
Yes, we see your mouse.
Yeah. So which one? This one, this one, this one, this one?
Thinking to your right.
This one.
To your right.
Right. Good. So the long jump can be broken down into 4 phases: the run-up or approach, the takeoff, the flight, and lastly the landing. Right. Now, the cause of a hamstring muscle strain is often obscure. In the second half of the swing phase, the hamstrings are at their greatest length, which is right here. And at this moment, they generate the maximum tension. Now, in this phase, the hamstring contracts eccentrically to decelerate flexion of the hip and extension of the lower leg. Now, at this point, a peak is reached in the activity of the muscle spindles in the hamstring. Now, a strong contraction of the hamstring and relaxation of the quads is needed. According to Claps and Arneheim, a breakdown in the coordination between these opposite muscles can be a cause for the hamstring to tear. The greatest musculoskeletal muscular tendon stretch is incurred by the biceps femoris, which may contribute to its tendency to be more often injured than the other 2 hamstring muscles during high-speed running. Now we'll take a look at the post-injury rehabilitation. And here we have a diagram showing the normalization of the strength length curve protocol. Now, hamstring flexibility may affect hamstring muscle maximum strain in movements. Sorry, let me repeat that. Hamstring flexibility may affect hamstring muscle maximum strain in movements. Now, with similar hamstring flexibility, hamstring muscle maximal strength is a given movement, and this may be different between genders. Hamstring muscle strengths in standing should not be used as an approximation of their optimal lengths in the calculation of hamstring muscle strain in musculoskeletal system modeling. And this is from the Journal of Sport and Health and Science, September 2017. Now, in the acute phase of hamstring rehab, the treatment should focus on protecting the injury and minimizing the range of motion and strength loss. So here, our goals are to protect healing tissue, minimize atrophy, and prevent motion loss. We should also protect, which means to avoid excessive active or passive lengthening of the hamstrings, and also avoid antalgic gait patterns. We should also ice 2 to 3 times daily. The athlete may begin pain-free submaximal isometric strengthening at multiple angles, which you may see in the figure on your screen, beginning at 48 hours, to allow the scar between the fractured muscle fibers to achieve sufficient strength to avoid extensive separation of the fiber stumps. So this is this picture right here, submaximal isometric exercises at 3 angles, 90 degrees, 60 degrees, and 30 degrees. So the patient would be seated in the seated position, and note that this will be performed at, as I said before, 3 angles. The hamstring should not be stretched into a painful range at this time, but available hip and knee range of motion should be maintained. We can also use soft tissue mobilization techniques, or it may be instrument assisted. We may also use pulse ultrasound, progressive hip strengthening, pain-free isotonic knee flexion, active sciatic nerve flossing, as well as ice with the sensor electrical stimulation. Now, the goals of this stage are to normalize gait and to obtain knee flexion strength greater than 50% of the uninjured length upon manual muscle testing at 90 degrees of knee flexion. Now, once these milestones are met, the athlete may move on to the next phase. So basically, in a nutshell, it is saying normal walking stride without pain, and you can see pain-free isometric contraction, which is again submaximal, which is 50 to 75% resistance during prone knee flexion at 90 degrees manual muscle strength. Now the subacute phase takes place at 3 days, and it may last up to 3 weeks. Now the goals of the second phase are to progressively regain strength throughout the range of motion and improve neuromuscular control of the hips and pelvis in preparation for sport-specific movements. End range lengthening should be avoided if painful in this stage. The athlete also may begin to strengthen concentrically and eccentrically at this time. We should also ice, and this is post-exercise for 10 to 15 minutes. Therapeutic exercises performed, and this is 5 to 7 days per week, includes stationary cycle, treadmill at moderate to high intensity, isokinetic eccentrics, limb balance, single leg stance with perturbation, and supine hamstring curls on Swiss ball, soft tissue mobilization as well. Nordic hamstring exercise, shuttle jumps, prone leg drops, lateral and retro band walks, and sciatic nerve tensioning. Now, eccentric training can be achieved using an isokinetic dynamometer if available, and performing exercises such as straight leg deadlift, single leg windmills, which is what you're seeing on the screen, as well as Nordic hamstring exercise. Now, to complete an eccentric leg windmill, the patient, as you can see here, stands with the uninjured leg on a chair or fixed surface and reaches down in a diagonal plane while keeping stance, legs straight, and maintaining lumbar lordosis. The Nordic hamstring exercise is performed by having the clinician hold the patient's feet while in tall kneeling. The patient slowly falls forward while maintaining neutral hip posture until he or she can't control descent any longer, and then pushes back into the starting position with the upper extremities. Now, the criteria for progression to the next stage includes full strength, which is 5 out of 5, without pain during prone knee flexion at 90 degrees, manual muscle strength test, pain-free forward and backward jog at moderate intensity, strength deficit less than 20% compared to the injured limb, and pain-free maximum eccentric in a non-lengthened state. And once the patient is able to do these things, they move on to phase 3, which takes 3 weeks to 6 months. Now, in the third and final stage, the focus of rehab is on functional movements and eccentric strengthening in the lengthened state. Plyometric and sport-specific training may be initiated as well as well as advanced balance exercise. We still protect, so we train within symptom-free intensity. As you know, every patient is different. We ice as needed. Our therapeutic exercise programs have decreased, so now they are at 4 to 5 days per week. The treadmill, moderate to high intensity as tolerated. Dynamic hamstring stretching, isokinetic eccentric training at end range of motion in hyperflexion, which you will see in figures 4, 5A and 5B, soft tissue mobilization, plyometric jump training, and 5 to 10 yard accelerations or decelerations, and that is very important. So here we have figure 4, and so the Biodex is a machine which may be modified so the patient is in hip flexion and then passively extends and flexes the knee into the end range of motion. Now the patient resists the passive motion as the knee is extended. It is imperative that the hip is positioned in flexion as the knee extends to ensure the hamstring is truly at a lengthened state. Figures 5A and 5B show alternative lengthened state eccentric training, which may also be achieved without a dynamometer by keeping the involved thigh on the subject's chest while resisting an outside force via elastic resistance TheraBand or cable column or manual resistance. Now, this exercise may be performed by having the patient lay supine, pulling the knee snugly into the chest while hooked up to the cable column or elastic resistance, seen in 5A. The patient then uses his or her arms to pull the knee into flexion and then slowly, eccentrically resist the cable or elastic band as it pulls the knee into extension. Now, at the completion of this stage, the athlete should have full strength throughout the range of motion and should be able to confidently perform all sport-related tasks without limitation. And here, so this is, as you can see, is the criteria for returning to sport. Now, as Mr. Wooler would have mentioned earlier, that there are different exercises that he would use based on the physiotherapist or the doctor's recommendation in allowing the athlete to, get back in it. And he did mention some, so this is just basically a reiteration. So, some sprinting drills, back to jumping drills, and at each stage you reassess. So at each stage of the long jump phase, you reassess and revisit exercises that will help with the phase that was identified to be problematic. So even though Nordic exercise and those listed above work to activate the hamstring muscles, so the athlete should spend a lot of time sprinting and muscle drill, and these are more related to the athlete's movement capability. Now, according to Van Tiller and others, 2017, the rate bar shows Nordic exercise do well, but the sprint training, is still the greatest activator of the muscle, which is the hamstring in this case. Now, some basic exercises, as Mr. Woolery mentioned, would have included, your bridging exercise. And here you can see it is done in the supine position, and then you would progress accordingly. So you would progress from single leg, you would progress to single leg from two legs, sorry, then both legs on a balance ball, then single leg on a balance ball, active knee flexion and extension on the ball with both legs, sorry, and then single leg, and then you continue accordingly based on the patient. And here you can basically see just a picture depicting how you progress in the bridging exercise. Exercise 2 involves the usage of TheraBands, and the patient is also in supine lying, and they use the SLR to provide maximum stretch followed by hip extension. It's a bit wordy, so I'll just show you a diagram so you can have a better understanding of the exercise. So these are also, this TheraBand exercise is used in particular in patients with hamstring strains. And another exercise would be the box jumps. And here you can see the progression from single leg. Let me just show you the picture. Right. And this is all dependent on the athlete. Right. So a study by Maliaropoulos and others examined 2 different rehab protocols to determine the effectiveness of each. Now, 80 athletes with acute hamstring strain injuries were assessed, with rehab occurring 48 hours post-injury. One group performed 1 session daily, and the other participated in 4 per day. Each session involved a static hamstring muscle stretch that was sustained for 30 seconds, and this was performed 4 times per session. The results indicated that the group, which participated in the greater number of sessions, which is 4 per day, were able to regain range of motion in a shorter period and therefore spend less time away from competition. Now, in conclusion, it is therefore safe to say that hamstring injuries have been long the bane of athletes' participation in sport, especially among those who engage in sprinting and explosive movements, primarily because of the high occurrence and recurrence rates. Now, these injuries appear to create subsequent weakness at the muscle's lengthened state, predisposing the athlete to further injury. The lengthened state eccentric training may increase the endurance strength, resulting in fewer re-injuries, and therefore should be incorporated into the rehab process. However, as you can see, that this research was done from 2004. So, however, it is therefore safe to say that further research is needed to determine the effect of lengthened state eccentric training on incidence of hamstring strain re-injury. And that's it for my presentation. Thank you guys so much for seeing with me through the entire thing. Just wondering any questions that I might be able to answer.
All right, thank you very much, Mr. Daly. We really appreciate you finding the time to share with us. We're going to be checking the chat, see if there's any questions there. I thought it was a well put together presentation, very thorough. Mr. Barnes, anybody has any questions on the live YouTube?
Oh, yes. Dr. Diallo Brown is asking, when would it be a good time to begin to reintroduce speed movements in hamstring rehab and how best to do this?
Repeat the question for me again? Well, I guess for us.
When would it be a good time to begin to reintroduce speed movements in hamstring rehab and how best to do this?
All right. So ultimately each patient or each athlete is different, right? And based on this research which I found, I think it was late 2017, you may progress based on you progress based on the criteria. If the athlete fits into the criteria, then you may start, for example, in phase two, sorry, and let me just find it, which is right here. So in phase two, you may start reintroducing. So here it says, the goal is to develop neuromuscular control of trunk and pelvis with progressive increase in movement speed, preparing for functional movements, right? So it can either be phase 2 or 3, but so most times you would start to reintroduce it from the phase 2, dependent on, if there's any pain and any pain or, muscular deformity, and, how the patient is feeling going forward based on your assessment. So it can be in phase 2, going on to phase 3.
Okay.
So basically, when I was doing my research, I realized that a lot of things have changed, especially from the onset. Initially, you wouldn't want to do certain movements in the initial phase. However, I have realized, especially being involved with soft tissue mobilization, that different treatment methods as well have different effects on different patients. And based on research, soft tissue mobilization in one sense and as one treatment method does actually improve the athlete's ability to return to sport faster than normal. So, and that is just one treatment method, right? So it all depends on, how you, as I said before, your assessment of the patient, and it can start within phase 2 to phase 3, but definitely one of those 2 phases, as long as the patient achieves the criteria to move on to the next phase. All right. And then, yeah, that. Any more questions?
Yeah, I'm waiting on one more question.
There's another question. There are 2 more questions on the YouTube live. A follow-up from Dr. Brown. He's asking again, how important is strengthening the glutes during hamstring rehab? And there's one more after that from a Kenny Connor, but you can answer the glutes strengthening question first.
All right. So I didn't come up on any research as it stated to the glutes. However, from prior knowledge, we understand that injuries occur along a plane, right? And therefore, you'd naturally have to strengthen all the muscles. So, especially, I failed to have mentioned that not only do you strengthen the hamstrings along the chain, but you strengthen all the muscles along the chain, sorry. So therefore, you would have to strengthen the calves, the hamstrings, the glutes, the lower back, upper back, shoulder, neck. Yeah, go right back up to the neck muscles. So I would say it is very important, but not just the glutes, but all the muscles along the chain. So that is very important. Thank you for pointing that out.
Okay, thank you. And then another question from a Kenwood panel. They're asking, should mental skills training be incorporated in the physical rehabilitation as well?
Right. So yeah, definitely. I appreciate the questions, you know, because these are just pointing out some details that were left out. The psychology of the patient is also, we also need to take that into consideration. And I know for some teams they provide a sports psychologist, but especially the return to sport, a psychologist is normally needed in the sense that they help to provide reassurance because a lot of fear is built up post injury, you know, and then this can be a limiting factor in the performance of the athlete. So developing the psychology or the psyche of the patient is also very important. Answer that correctly?
I think you addressed it well. I
Okay.
guess that's it for the live questions. I guess we can move on to the Zoom chat questions now.
Excellent. I have one from Christina Gonzalez. She says a bit long, so she's gonna unmute and then ask you the question, Mr. Diary. Go ahead, Christina.
Okay, good afternoon, everybody.
Good afternoon.
So my question was really as it relates to flexibility.
Right.
So you had mentioned earlier that one of the main reasons for hamstring injury is hamstring tightness. So what I was wondering is if there's any type of screening that we can do as clinicians to see is this athlete ready for sport, or even after, if for example somebody has got an injury, how do you know that okay, the hamstring it's functional to the point, not just functional like as an average person because it's an athlete? How do you look and say okay, you're ready to go back to sport? And then also the second part to that question would be what would a flexibility training program be for an athlete? Because I find that it might be just me, I don't know, I don't have a lot of experience, but what I find is that even in just like working out in a gym, a lot of persons do not really focus on flexibility as an integral part of training. And I find I'm wondering if that is something that could be addressed in terms of preventing future hamstring injuries. That's my question. Hope it's clear.
All right, good. So the first part, to answer the first part of your question, as I had stated before, there isn't a lot of research dedicated to determine the effect of flexibility on hamstring strain or as it relates to re-injury. So more research is done, more research is needed in that regard. However, as I had stated earlier, when you're assessing, especially the length of the hamstring, you can't assess it you can't assess both. First of all, you can't compare men and women. That's the first thing. And second of all, you can't compare it in a standing position, because you'd actually have to overextend the hamstring in order to determine the full length of it. And so yeah, you will therefore be able to identify if one is tight compared to the other one, as well as you'll always tend to do a comparison between both legs. And this is also a requirement when you are transitioning out of one phase to the other. Because as you can see, a part of the requirement is whether or not if the injured leg submax is 50 to 75% of the uninjured leg. right? So it is always a comparison between both legs or both hamstrings, and then you're able to determine going forward, right? To the second part of your question, ultimately, I believe as clinicians, we would already have established a relationship between ourselves and our athletes. We would have already done an initial assessment. We would have already found out that, look, your runoff is the problem, or your takeoff is the problem. You'd have already identified along which stage in the long jump phase, or if you're not particularly talking about long jump, you'd have already identified a point in which there is a hole in the athlete's game. So therefore, going forward, it is up to you as a clinician. You make your assessment and you treat accordingly, you progress accordingly, and then ultimately the decision is up to you on how the patient or your athlete progresses. As it relates to flexibility, as I said before, not much is known, but if you do find more information about it, please feel free to let us know. All right. I hope I answered it. I tried to answer the best way I can. So if anyone else has anything that they would like to add, please feel free to, let everyone know.
Sounds so I believe in the chat. We're saying, would establishing pre-season / pre-competition strength, flexibility, and endurance measurements allow us to have data to use in rehabilitation in addition to using limb symmetry? It's a pretty long question. You want me to repeat it again? From Jared Harris, it says, would establishing pre-season / pre-competition strength, flexibility, and endurance measurements allow us to have data to use in rehabilitation in addition to using limb symmetry? Yes, I was actually posed to everyone, but you're on the presenting. So.
Sir Thomas, you sound like you're opting to answer that question for me.
I wasn't. What's your thought on it? Let's share your thought on it.
My thought on it. Naturally, I mean, data is very important. We wouldn't be here today if we never gathered data and did our research.
That's the reason why we have.
Yeah, and new treatments would not be available now if it wasn't for data and research. So naturally, in each individual patient, yeah, you would definitely need to have the data pre-season, post-season. As the muscles get stronger, they get bigger, So in case the athlete gets injured, you can always, go back to that data. And, but what I would say though, everyone, is that based on my experience, I've seen a lot of, this isn't being done. Basically, this isn't being done how, you would want it to be done. And therefore, I believe this is a downfall in how we may treat our patients going forward. So it's a valid point that, it all comes back down to, whether there's resources and all of that. So you do need it. It plays an integral role, but the question is whether or not it's being done. You understand? But it's very important.
Yeah. All right. Thank you very much, Darley, for presenting to us this evening. Really appreciate it.
If I might say something, I didn't say where I could put my hand up in answer to the question.
Go ahead, Joan.
What Andre said a while ago is real, but I think one of the things that limits us as physical therapists is how many of us are actually intimately involved with teams, because you can only do a pre-season evaluation on a particular athlete if you are that involved with the team. If you are only seeing individuals when they become injured and then taking them through rehab with return to play, you don't really have that link. So whereby it is a very valuable tool and one that would be encouraged, it would be something that you would have to speak with the coaches and get the coaches involved. And if you are linked with that team, you could set the parameters that you think would be best for getting the type of data that you need. And then you can use that in measuring an athlete who becomes injured after. So you'd have to really set up a whole system, which I do not believe happens nowadays or today, to date. I think we athletes go out, they train, but there's nothing, no sort of record as to what they come in with. No sort of baseline data for them. And if there was baseline data, then you could work out your pre and post and in between rehab for whoever becomes injured. That's my contribution.
All right, thank you very much, Joan, for that input. All right, so thank you very much to all the presenters again, and for those who were able to join us on yet another Keeping Pace. At this time, I'm going to ask Mr. Aaron Atty to just close for us. Just close the meeting for us, please.
All right, good afternoon, everybody.
Afternoon, Mr.
Yes, so we have come to the end of our Keeping Pace seminar for today. Just want to say a big thank you to everybody that turned up today. All right. So on behalf of the organizers of this virtual seminar, would like to thank all who took the time out of their busy schedule to be with us today. Without you, this would not have been possible. So gratitude is a must. I want to say special thanks to our presenters. First, we had Coach Woolry from the Petersfield High School, who shared some of his knowledge in regards to maximizing performance in our athletes and preventing injuries. Right? He emphasized the importance of having a good warm-up, give us some examples, your short sprints, the high knees, your butt kicks, and so forth. He also mentioned the importance of recovery in our athletes. That's one important aspect of his training that he has going on at Petersfield. Then we had a presentation that was created by Dr. Cox and presented by Dr. Beaton. Yeah, so that was another very informative presentation. Right? There's a lot of information that was in that presentation as well. All right, and one point that I remember is that hamstring hinges tend to happen with explosive sports, whether it be your track and field, the football, and so forth, you know, and it normally happens with flexion of the knee and extension of the hip. So that's a key thing to remember. All right, and now we close off with a final presenter, which was Mr. Andre Doyle. Another very informative presentation, very well put together, you know. So I must say a big thanks to all the presenters again. And thank to all the persons who came out and they supported us through how much from 2 to almost 5 o'clock. So it's been a while. So thank you guys and enjoy the rest of the evening. And one more thing, keep in mind our next Keeping Pace seminar. The tentative date is September the 12th. Is that right, Mr. Thomas?
Yes, tentatively September the 12th. Yes.
Tentative September the 12th for next seminar. All right. So
All right.
thank you.
All right, guys. That was good. Malana will talk off.
All right.
And the next Keeping Pace will be hosted by the Central Chapter on September.
All right. Thank you, everyone. So.